Good morning and welcome to this webinar for the Eastern area of the Institute of Water. My name is Nicola Johnson and I also work for Anglian Water Services, but I'm also the CPD champion and the Eastern area comms lead. I'm really pleased this morning to welcome our speaker, Carl Faisey. He's probably one of my oldest work friends, and I think I've known him 27 years now. We can still put up with each other, so that's a good sign. And he's going to do a beginner's guide to fluoridation for us today. All of these webinars are recorded, so you will be able to watch them back later. And you will have the ability to ask questions. The Q&A is enabled, so feel free to either type us a question, or at the end there will be an opportunity for question and answers, and you can come off camera and sound as well at that point if you wish. Feel free to stay on camera if you want, or just otherwise you'll feature in the video, but that's absolutely fine. Other than that, just a reminder that these webinars do not happen without the support of our sponsors, Claret's, Anglian Water, Merit Skills, Clancy, AC Contracting Group, Kier, RSC and Windmill Insight Solutions. Without their support, none of these events happen. I also encourage you to check out our other events, because there are lots of webinars coming up in June and some in-person days. And also we've got our President's Day coming up in June as well, which is a face-to-face. So if you're in the area, please come and join us. All members and their families are welcome. So I'm going to hand over to Carl Faisey. I'll take it out of share and I'll let Carl get his slides up and sharing. As I say, please feel free to ask any questions as we go. Just pop them in chat and we'll pick them up, and then we'll do a bit of a round robin at the end.
Nicola,
so Carl,
can I just, Nicola, you've just taken it out of share and it's just disappeared off my screen.
Yes, you need to share yours now.
Oh, okay. Can you see that?
Yeah, just take it back. You've just not your first slide.
Okay.
That's it. There we are. We're ready to go. Brilliant. I'll hand over to Carl.
Hello, everybody. As Nicola said, my name's Carl Faisey. I also work for Anglian Water. I've worked for Anglian Water for, as Nicola said, nearly 30 years now. I'm starting in the laboratories and in scientific, moving in several roles over the years, capital delivery, and now I currently work for the supply teams directly, looking at their chemical dosing. And today, when I talk to you around the introduction to fluoridation, this is a entry-level discussion that we're talking around, because as you will find, fluoride is quite a niche subject in the water industry anyway, and hopefully by the end of this talk or conversation, maybe you'll have understand a little bit more about where it came from, and some of the challenges around fluoridation. What this is not necessarily is a nuts and bolts discussion on around actual chemical dosing, but hopefully this will give a broader baseline subject for you to build on if you're into or looking to get more knowledge on generally fluoridation. So taking this back, telling a story, I don't want this to be death by PowerPoint or whatever it might be. It's more of a story around fluoridation. Fluoridation has been around probably a lot longer than many of us actually really realise. Going back, it was always, as is all good stories, there's some sort of science in it, and the story was really around absence of decay. So fluoridation, two American dentists, one in Colorado in the Midwest and another who was stationed in Italy, actually noticed at similar times around the turn of the century that some of the staining on the patient's teeth actually was mottled. It gave a mottled effect to the staining, but that also came with a secondary feature of actually there was limited decay around those teeth in those areas compared directly to some of the other areas that were immediately adjacent, and we're talking only a 20 to 30 mile range. this was later built on later by a chemist, Churchill. And he was working for a mining company actually at the time, and he was concerned in the 30s that still in the States, that this was linked to the presence of metals, and that metals were in some way mottling patients' teeth. And he actually was the one who tested the water in that instance, looking for high levels of probably aluminium and some of the high concentration metals, but found also that in comparison to other areas, there was an elevated level of fluoride. And this was generally known in the States as the Rocky Mountain mottled teeth syndrome. And this was just noted that these patients very often were having the same diet as everybody else, but still, and some similar sort of working environments as well. Life in the late 18th century, early 19th century was quite hard. And it was only when this information was published that another dentist, as it happened to be, because they're the guys that are looking at your teeth in the UK, built on this syndrome, this mottled teeth investigation. And in 1925, a guy called Mackay, he was the first to produce a literal statistical summary of around these 4,000 children, and was able to compare those direct decay rates. And he also was looking at areas of the water supply in the area in and around Essex and Maldon and the small town of Witham, in and around that area. And he found that the Witham dental decay rate was low, but it did have some small staining. And he found that at the time, there was around about 0.5 to 1.5 milligrams per litre of fluoride in that water. Whereas the staining that you saw significantly in Maldon was up at 5.5 milligrams per litre. And this was significant to Mackay. To Ainsworth, because he saw this as a direct link between fluoride and tooth decay and mottled teeth in the UK. So where did and when did fluoridation actually occur? So although these guys had that link between levels of fluoride, mottled teeth, and less decay, there wasn't actually a fluoridation program until 1945. And this went that in Grand Rapids, Michigan, this was the first town to artificially fluoridate. And it was found that anything really above 0.7 seemed to give a beneficial effect to the reducing the actual decay rate. And so this was installed. There's still the sign there that is there today in Grand Rapids, Michigan, that indicates where the artificial fluoridation program began. And that's been in effect for over 80 years of fluoridation in that area. And in fact, the study then went on to go further, and it actually looked at the survey 6 years later after that was first introduced. So we're looking at children that were born completely within the fluoridation aspect of dosing, and found that it was almost half that. The decay rate was almost half of the town in Muscatine. And that was really significant, and that really showed a significant level of support to the adoption of fluoridation widely, actually, across the USA. And from that piece of work, fluoridation came to the UK it got attention in the UK. However, in the UK, legislation is king, and before any legislation could occur, the UK government wanted to introduce it, but only where there was strong evidence of tooth decay. And tooth decay tends to also be linked with some strong socioeconomic factors in the day. So we are talking mid-century, in the last century, that they were looking at this data, and in fact, some of the prior to the war, one of the fundamental aspects of wanting to join the army was to have 6 opposing teeth, top and bottom, and many youngsters, 18, 19, 20, failed to get into the army due to the level of tooth decay. So the UK government looked at these areas and decided that they're going to have to draw up some agreements. And these agreements were between the local water boards, as they were at the time, very locally set out. As any of you guys out there that have got any of the history between any of your local water companies, this is way prior to prioritisation and larger geographical areas. These were individual water boards. Very often they were local water boards attributed almost to council level. And these agreements were written and drawn up in the 1960s. And they were between the local water board and the local councils. And these agreements were targeted to certain areas. This was not a widespread fluoridation program in the United Kingdom. This was introduced. These agreements were introduced to the water boards in the mid 60s in like Birmingham, in that area, and in the later and early 1970s in the other parts of the UK. So legislation today, and I don't make any apologies for legislation because it has a significant impact on fluoridation as it stands today. Legislation concerning fluoridation. So the acts are written into the Water Industry Act, actually, from 87 to 91, sections 87 to 91 of the Act, and the amendments to the original legislation were made later. But one of the big, and as you are all aware, being industry professionals, there are always amendments to certain legislative acts. Health and Social Care Act in 2012 was a big up-to-date legislation specifically looking at parts of the fluoridation world, and that incorporated many of the other provisions which were in all the previous acts, and it clarified the responsibilities between health authorities and water companies, indeed. And became an update occurred in 2022. So in that act, it was directly between the health authorities and the water companies, and the government bodies such as Public Health England acted on the behalf and were there to oversee the fluoridation programme. The Health and Care Act amendment transferred that responsibility of water fluoridation away from those local councils and things like that to the Secretary of State for Health and Social Care. And although that meant that still a public consultation is always needed and the Act mandates that you have to have a public consultation if you're going to introduce or even significantly vary, more than likely, an amendment as it's sorry, not an amendment, an agreement as it stands. This was quite a significant change to the water industry, and I'll get onto that in a moment. But why and where did they choose to dose fluoride? And it was, as I say, directly resulting in those socioeconomic factors. Tooth decay tooth decay in the UK is still preventable disease, but it is still significant. In school years, and this is just taken from stats from a recent government documentation, in the school years in 2019, almost a quarter of 5-year-olds were demonstrating some form of decay. In 2019, 6% of children aged under the age of 16 had time off, which again has socioeconomic impacts in that if they're having time off due to pain associated with teeth, mouth and gums, it probably means their parents are also coming to look after them and having time off. In 2019-2020, 35,000 children aged 0 to 19 were admitted to hospital for extraction of decaying teeth. 35,000. And those children, generally, if they're having teeth abstraction, they're under general anaesthetic. So that's having a whole team, an anaesthetist, dentists, nurses, all coming to look after those children. And those costs to the NHS estimated were at £54 million, 54.6, I think it was, million pounds to the NHS, which is a significant cost to the NHS. And that cost is actually always increasing. But what is tooth decay? What do we refer to as tooth decay? Well, tooth decay, or dental caries, as our colleagues, medical colleagues, refer to it, is basically cavities. And decay is due to acids in the mouth. So eating normal foods, you're masticating the food within the mouth, the bacteria that are produced, the bacteria that are there in the mouth, they generate sugars as a byproduct of metabolizing that food product in the mouth. And those bacteria, they feed on those sugars and form that sticky film, that plaque. And it's that plaque that starts to demineralize the teeth. Now, the teeth, as you're probably well aware, if you like me, are into local history and things like that, and you'll see that when any archaeological excavations occur, if they find skeletons, they very often find teeth. Teeth are some of the hardest substances in the body. So this slide's in there. It's basically a calcium fluoride slide. It just indicates it's quite a solid structure that calcium fluoride actually forms. And I'll come to reference this slide in the next couple of slides. But it actually, tooth enamel is, like I said just now, is extremely hard. It rates on 5 on the Mohs scale, so it's as hard as steel, far more brittle, but it's hard as steel. And it's fluoride. Essentially, fluoride in the saliva actually promotes remineralization of that tooth enamel, and it generally is by the fact that the calcium is actually forms with the fluoride, and it forms an actual remineralization effect, and actually protects the fluoride from cavities. Sorry, protects the teeth from cavities. And it is a really difficult and really sensitive process, because obviously there's lots of other factors that are involved in that pH of the mouth, etc., which can also lead to genetic a genetic way of actually predisposing yourself to cavities or against cavities in some respects. So I've talked about where there's a social economic risk, and I've talked about how the actual fluoride does protect in the sense of within the mouth and forming a strong calcium fluoride. But where in the world, and specifically in England? Well, in the world, fluoride, and fluoride, I will say, and I will say this anyway, is naturally present in lots of different things. And because there is an artificial program, many people think that it's completely artificial. Well, it's commonly found in minerals. Fluorspar is very high in calcium and composed of calcium fluoride. It's also found in minerals like apatite and things like that, which also have very high phosphate levels. So dependent on a market price, if you find a seam of apatite on the raw material, it depends on which one that they want to sell as the market, to the market as regards whether it's a fluoride source or a phosphate source. But fluoride and background fluoride levels can vary significantly. They can be as low as 0.1 milligrams per litre, or they can be extremely high. East Africa, Kenya, Tanzania, South Asia in India, China in Shanghai, and forgive my pronunciation on that, but in the Middle East, there's significant amount. Israel, Iran, Saudi Arabia, they all have significant amounts of resources of those minerals. Specifically in the United Kingdom, we have high pockets of high natural fluoride. Bath, Swindon, East London, and even Hartlepool all have high natural areas of fluoride. And they can be found not just in groundwater, they can be found in seafoods, they can be found in teas and coffees, grapes, spinach is a high good natural source of fluoride, and many dairy products as well, as you'd imagine, have a high natural fluoride. But where is that fluoride in the UK? Well, about 10% of the population in the UK receive fluoride as it stands right now. And you can see from this graph where the green indicates the artificial areas of fluoridation. And this geographic seams of high fluoride, as you can see coming across the southern counties there, parts of the coast of what would be East Lincolnshire, and in the northeast around Hartlepool has very high levels of fluoride, well above the PCV for fluoride in the UK, which is 1.5 milligrams per litre. So if 10% of the population receive either artificial or natural fluoride that's of a significant level that would help with dental decay, that's around 6 million people currently. So who does that, and where is it dosed? So 5 companies currently are under an agreement, and those companies were, during privatisation, those agreements were transferred over from the water boards as they were then to these the bigger companies that were of that geographic area. So that includes Anglian and Severn Trent, South Staffs Water, United Utilities, and Northumbrian. All have agreements that were carried forward with the government as it stands now, to actually either enhance the level of fluoride to 1 milligram per litre, not 1.5, but just to 1, and that's their set point. And that is ubiquitous everywhere for all those companies. So they're basing that enhancement based on their background level in fluoride. So actually, they might not be dosing 1 milligram per litre, but they're enhancing it to 1 milligram per litre. Now, if you put that in context and you all go and look at your own toothpaste in your bathrooms, you will probably find that your toothpaste contain a fluoride level between 1,000 and 1,500 milligrams per litre. And I'll touch on one of those subjects around artificial fluoridation, mass medication, all that kind of stuff, because it's to do with the wider aspect and some of the challenges to the water industry and to the population as a whole. So how and where do we dose? Well, the decisions needed to dose don't come particularly from the water company. They feed into those decisions. There's public health recommendations. So as the current agreements exist, they were based upon public health recommendations, and the DHSC, the Department for Health and Social Care, may recommend water fluoridation based on evidence from the health service. There's obviously legislative and regulations that would come into play. Local authorities, since those agreements were taken away from them to the Secretary of State, those powers, they can apply for a fluoridation to occur in those areas if they feel that there is a valid reason for fluoridation, and they would have to go through the new schemes through the Secretary of State. And obviously water companies, and this is one of the big challenges with the modern day water company, is water companies have to assess the cost and feasibility of implementing a fluoridation scheme, especially into existing networks. And as many of you are aware, an existing network in the 1960s might be a very different network in 2025. And obviously, as I've said before, public consultation. Public consultation are made. There must be a public consultation process to ensure that the community's views are considered. So it helps address any concerns and ensures transparency. Anglian Water, where I work, covers quite a wide geographic area. In fact, Anglian geographically is the largest of the water companies. And generally speaking, the water supply boundaries that we focus on are in the sort of western side of Lincolnshire, and in the areas in and around Bedford. So how do we as a water company, how do all the other water companies have any kind of guidance on where and when they can dose fluoride once that agreement is in place? Well, the Drinking Water Inspectorate, the DWI, they author a guidance document which highlights what is required, what would be needed to comply to do a fluoridation dosing system. It identifies the types of chemicals. There's two main chemicals, disodium hexafluorosilicate and hexafluorosilicic acid. These are the two chemicals that are available to use in the UK. And all these chemicals, goes without saying, must have a BSEN number that is relevant for that document. In that document, as all good guidance documents do, contains many aspects. So it's freely available on the DWI website for you to actually go and peruse the document itself. It's a guidance document. It covers things like chemical deliveries, where, when, how you do a chemical delivery, the storage of that chemical transfers, the minimum requirements that you're all going to need to have to do this, dosing into a flow, the types of dosing lines, the monitor requirements that you're going to need, shutdown telemetry, even the training and how we will report the control and the results to the either the Drinking Water Inspector themselves or the DHSC, the Department for Health and Social Care. So this in Anglian Water is a very general map, because again, I like maps. It makes things nice and easy. And this is the top part of the East Anglia region. You can see there highlighted, the green areas are our fluoridation areas. So you can clearly see the area of Lincolnshire here. And this part is Lincolnshire. There's a small part of North Nottinghamshire that Anglian fluoridate, and down in Bedfordshire. So they're the three main areas within the Anglian area. And in the Anglian area, that background fluoridation tends to be within around 0.1 to 0.4 milligrams per litre. So we are having an increase in that area. That's not to say, though, that there isn't anywhere else in the Anglian area where we have to use dilution systems to bring the fluoride levels down to below 1.5 milligrams per litre, because they're naturally high in fluoride in some areas. In Anglian Water, we are in the process of upgrading a lot of our chemical dosing systems and a lot of our assets generally anyway. However, the fluoride system, that's an example of one of the fluorides, what we call a dosing kiosk there. It's very close to the point of application. In fact, you can see the point of application is here, and the measuring point that feeds back into the kiosk is there. It's a bunded style, self-bunded style kiosk, and it's completely self-contained, trying to improve that level of process safety. So that is one of our important strategic steps that we are looking to taking fluoridation into certainly into the next AMP period and the following AMP period. So what does the Department of Health, what are the challenges that they set us as a water company in general? Well, they, like anything, they want value for money. It's taxpayers' money that pay for fluoridation. So dosing in Anglian Water is we set ourselves this target, 95% compliance, and we aim to maintain that compliance. But that has many challenges. Obviously, there's, as I've touched upon, there's the asset upgrade. So 95% compliance in any 1 month, to ensure that you can stay within 10% of the 1 milligram per litre target value. It gives you a day and a half of underperformance before you're out of that 95% compliance. So that's quite a tight target anyway. Because like anything, fluoride can have many other factors affecting it that are not really related to fluoride. Flow changes, sites stop, all those sorts of things can change the availability of fluoride. But actually, fluoride is measured at the customer property. So if one site stops, it's advantageous if that same zone is fed by another fluoridated site. But that's not always the case, and there is a complexity around the modern utility, and particularly its future challenges. A lot of the agreements that, like I said, were set up in the mid-60s, and water companies and the infrastructure in particular was very different. And other legislation also has come in, not directly relating to fluoride, but as a lot of you water professionals out there know, there are many different regulators and many different challenges to fluoridation. So, these agreements they were written of their time, so they stated an area very often, and they were agreements between very often the Privy Council and the Lord Mayor Alderman and people like that. But we now, since privatisation, we have challenges like population growth. We have challenges like resilience assurance with multiple feeds into different zones. We have license restrictions from the Environment Agency, where some sites are producing or are able to take less water now. So other sites may have to feed into those areas to maintain the level of compliance that we need in many other factors. And those sites may not be fluoridated as they once were. So there are lots of challenges around that. Even the creation of public water supply zones. The creation of a public water supply zone how does that match with the legal agreements? Well, in Anglian, ours actually match really quite well, because we've adopted water companies and set the supply zones up in accordance with that. But how do those challenges then carry forward with people moving into different areas? The question I would put to you guys is, how many of you guys have moved to a house in a different area altogether and considered the level of fluoride that house is now studying served? Probably not many. So what are those original challenges that were set up in the 60s, and are they still current, and are there many more now in the water company? Yes is the answer to that. There are many more challenges, and they can be very bespoke to individual areas. So as I've said to you, there may well be in future there's a wider element to this as regards socio-economic factors still. People being able to actually get hold of dentists. Does that drive political direction for fluoridation? So authorities that have, like I've said to you now, applying to the Secretary of State for new schemes and the potential expansion of the fluoridation programme. Population growth, the resilience and assurance to feed multiple zones. So many water companies have got multiple different sites now that feed the same zones compared to the 1950s and 60s. License restrictions, as I've said before, and the creation of these zones and zone boundaries in particular. These are all challenges, because to move water around to areas of water scarcity now, we may be going through fluoridated areas. We may be going through non-fluoridated areas with fluoridated water. So how do we separate that? Because although fluoride and non-fluoride areas perfectly safe to drink, those agreements are set. Now, in the Act, obviously, water companies have that proviso where there is a public health need to supply water where it is needed in the event of bursts and failures of significance. But that's not a permanent move. That is a temporary issue. So future capital and future design has to incorporate and has to think about where we have fluoridated areas. And that is a significant challenge to meet other more significant challenges of population growth, for example. The latest expansion that we've seen in over 50 years from when those original agreements were written, occurring in the northeast. Some of you may well be from the area, but and you may well see this. This is a published material, but Northumbria embarking on an expansion program, which actually increases their area of fluoridation very significantly from what they were in the yellow to what they will become with the green on that map as well. And the area you can see there is Hartlepool. Just to put that in context, you've got Newcastle and South Shields and the areas around there in this area here. Hartlepool is not listed in there just because it's not part of Northumbria. But that latest expansion program is a significant change to what we've seen in certainly in the last 50 years. So I'd like to just pause there really and open the floor to any questions around what I've talked about today. I mean, today is very much an introduction to fluoride, and it just indicates where fluoride is and isn't, and some of the challenges around fluoridation. I haven't today gone into the nuts and bolts about chemical dosing, but I hope it highlights that actually fluoride doesn't occur everywhere, although it does occur generally in the Midlands and the north of the UK currently. But I open the floor to you, Nicola, and to any questions that may have come in.
Excellent. Thank you for a really interesting talk. It always amazes me when you get the number of admissions to hospital. Michelle, you've got a question.
Yes. Do you currently have anything in proposal for any changes or public consultation in the Anglian region?
No, that's nice and easy. At the minute, no.
Excellent.
Not at the minute, Michelle. We have regular meetings with our colleagues from the Department of Health, and if we was to hear of any of that, I'm sure we'd be the first to be in discussion with them around that as well. But not at the moment.
I heard a bit of a rumour from a manufacturer that provides fluoride equiment, but that might have been a bit of a sales pitch, possibly. Then I think.
Okay, yeah, that they can sometimes do that. But no, there's a big clamour for those kiosks that I've mentioned, Michelle, and those kiosks, and because fluoridation is quite a niche subject, and even a niche subject in the water industry, as it doesn't occur in all the companies. So and there's those kiosks and kiosks similar to that, and chemical dosing. The water recycling and the wastewater teams out there are doing a lot of P dosing at the minute, and things like that, and work on discharges and all that kind of stuff. So those kiosks are in quite high demand anyway. But at the moment, as we sit here today, Anglian have not had any direct requests that I'm aware of around fluoridation or an increase in that to vary any agreements or to increase the areas that are going to be dosed.
Excellent. Okay. We've also thanks, Michelle. We've also got some questions on chat for you. From Brian, I moved to Scotland in 1989, and the first place had to eat fluoride tablets. We did this daily at primary school between the age of 5 and 11, primary 1 to 7. It no longer happens. Can you tell me if Scottish Water uses fluoride dosing? But I imagine they do, since we no longer use fluoride tablets.
Interesting. Thanks for that, Ryan. I'm not aware that they do have fluoride dosing. I must admit it's a blind spot in my knowledge on that around Scottish Water, but I don't think they do. But I may well stand corrected on that. I'm sorry.
I think when I did some research for our training material in-house, I'm pretty sure they weren't one of the people that were on the list, if I remember rightly, she says.
Yeah.
But again, I'll stand corrected. One from Vince. Do artificial dosing and natural sources take the form of inorganic fluoride compounds such as NaFl or CaF2?
A CaF2.
There you go. That was an easy one then. And one from Natalie. I'm not sure if I missed it, but do you measure at customer taps and find you lose concentration through the network with mineralization on the pipes? Oh, that's a good question. I like that one.
Generally, we don't. In Anglian, I can't speak on behalf of the other water companies, obviously, but in Anglian, I say we don't. It's very difficult sometimes, as I mentioned before. We do an enhanced program in Anglian where we have fluoridation at the customer properties, but there is a regulatory requirement generally anyway. Excuse me. So it just depends where you sample in the zone, because if you've got multiple feeds into the zone and one site might be doing 1 milligram per litre exactly, and the other one might be doing 0.9 milligrams per litre, you might have slight variance. So attributing remineralization to the pipework or to blend is a difficult one to sort of understand, really. But generally, what we dose tends to be what the customer also receives, bearing in mind blending or any other non-fluoridated inputs into that zone.
Brilliant. I've got more for you. One from Jim. That was brilliant, Carl. Many thanks. I just wondered if modern dental practices are way better than in the 1960s or in the 80s and 90s. So I question, is there still the same need? And if there, is there a logic to making ubiquitous to reflect that the spatial socio-demographics are themselves very different?
Yeah, you're absolutely right. Big significant difference. Obviously, the introduction of fluoridated toothpaste in the early 70s made a big difference. There is still socioeconomic areas that are reflective. The government produces a paper every 3 years to do studies on this, to keep it A, current, and to B, provide the ministers and civil servants with the information they require to either support or vary any kind of fluoridation agreement. So there is a factor around, and you'll see it whether you go to any local dental surgery or doctor's surgery, in fact, where schools are very often offered toothbrushes and information letters on cleaning teeth and things like that, because there is a good argument that a lot of people actually voiced around fluoridation. As a water company, we're perfectly neutral on the whole aspect, but around, well, if people are educated and they have better diets and they look after their teeth more, they could probably reduce their dental decay. And if you look on the map that I showed around the southern areas of the UK, there isn't that level of artificial fluoridation program down there yet. And that may well be to some socioeconomic factors. Generally speaking, it's tended to be in the north from the mid 60s and 70s of the latter century. But yeah, it's an interest we're on. It's open for debate, and the DHSC do field those sort of questions quite regularly.
Yeah. And then there was a follow-up just comment from Jim as well, that when he was at Water UK, I was involved with the Southampton proposal, and I recall it was scuppered by public opinion. What's the mood music for the North East on the expansion plan?
So, as I said, Jim, there was the significant change to the amendment in 2022, which basically gave the ultimate power to the Secretary of State to decide the fluoridation. The consultation has to occur anyway, and in the Southampton consultation that occurred in the late teens, early 2020s, somewhere around there, that you're quite right, the public feeling for it was to be, I think it was against it in that respect. I don't have the full detail of it, obviously, but now that the Secretary of State could even, he or she could even say, yeah, we appreciate the public consultation views, but the socioeconomic factors and actually the cost of dental decay means that actually we're doing it.
Yeah.
Whether you've got a view on that or not, and then they instruct the water company one way or another.
Yeah. One from Joe, really interesting. You didn't have New Zealand as a high fluoride country, but I understand dentists in New Zealand come to the UK because they don't get enough practice on fillings and extractions.
It is.
Friend used to be a dentist.
It's a good point, Joe. Yeah, New Zealand is a high fluoride country. It is a good point, but I was limiting the number of sites. It is ubiquitous worldwide. They're just examples, but yeah, it is ubiquitous. And yeah, I actually do know that New Zealand does have a very reasonable natural background fluoride level.
Brilliant. And also a follow-up there from Joe as well. I know you said you're not touching on dosing, but from memory, when I was in production manager in Thames, fluorosilicic acid is very corrosive and difficult to handle. Why do we use this? Are there any chemicals which are easier to handle? That's a good question as well.
Yeah, it's a great question. It is very corrosive. In fact, all the water companies are very, very careful with their use of the HFSA. The answer is that the DWI stipulate two main chemicals that we can use. We only use a concentration at 20%, and of that, it's around a 14% concentration of fluoride in there. So it is on the lower end of that concentration and that level, but we have regular training as part of the code of practice. Nicola, I know you and the team do a specific training in Anglian around fluoridation and the risks, and we also have just recently done a health and safety training around fluoridation with the teams that operate that. They have specific training on fluoride as a separate chemical, and assessments also in Anglian for fluoridation. So the teams are very well aware and made well aware of fluoridation. There is lots of other aspects I could talk about the actual chemical dosing of fluoridation and some of the risks, but generally we've got the choice of two particular chemicals that the DWI have recommended in the code of practice. The HFSA generally is the liquid form, and the powder is the other form, which generally is only in operation in one other site, and that's a very large volume site.
Brilliant. Just a comment there. I'm sure I read somewhere that lead fluoride coating can develop on lead pipes, but this is displaced by phosphate, so it's more an observation. There's one there from PAC as well. Could you comment on fluoride resistance, public fluoride resistance, which I think you've already touched on with the other question, and how this has impacted on the programs you talked about, and a very interesting talk. And then if I just come down to Brian, how do you ensure the correct dosing arrives at all extremities of the network? For example, would you use hydraulic modelling and run an age of water analysis, or would you top it up further down the network?
So obviously the networks are covered, our zones are very much identified as a fluoridated area in Anglian. So we have a very much of a known inputs, whether that be 1, 2, 3 known inputs, and obviously covered by zone boundary valves and things like that. So there has been some form of hydraulic modelling just recently within networks where we've identified any kind of abnormalities or issues, but generally we don't have to top up anything. It's more a case of seeing dilution, if anything, in any of our networks specifically. Can't speak on behalf of some of my colleagues in Severn Trent South, Staffs, etc. But yeah, generally for us, it's a dilution that we tend to see is the problematic. We can't top up anywhere. It is flow proportional, but it's not any kind of set point trim or anything else like that.
Brilliant. Okay, I think we're pretty much there with questions, and we're coming up for 5 to 12 and lunchtime. So it just goes to say thank you, Carl, for joining us. Some brilliant feedback on chat there, and a really interesting talk as ever. And even I know I do a lot of stuff on fluoride in-house, but I still learned some stuff today. So it just goes to show you can never stop learning. We're back next week with a CPD webinar with Cara Sadler, finding out how she's gotten in the last 10 years since she won her CPD award. That event is live on the system, so please do sign up for it, and I will see you again. Brilliant. Thank you, everybody. Have a good weekend.